Hello everyone. I have some fantastic news for you, positive news after everything we're hearing otherwise. So there is a scientist called Michael Levitt who's discovered that there is a cross resistance between the common cold virus and the COVID. That means if you have had a cold sometime in the past, I'm sure all of you have had a cold sometime, it could actually give you a natural innate immunity to the COVID virus. So this cross-reactive T cell recognition is seen between these common cold coronavirus as well as the COVID-19, which is there right now. So this is fantastic news because sensible behavior from your side could change everything. Please share this. This is my humble request because this can really save lives and bring down the mortality and really cut the chain. So there is another study which was done, which shows, again, a lot of the people are asymptomatic. Even in Tamil Nadu, more than 90% of people are asymptomatic. But that doesn't mean they don't have any problems. So what have they found? When they do the CT scan, they're finding ground glass opacities. That means circles like glass. So this can lead to breathing difficulties later on or other issues. So we really want to avoid it. So what is the trick? If you have tested positive, even if you're asymptomatic, you want to stay home for 14 days, exactly as you would treat chickenpox. So what does this do? This actually stops the cytokine storm. That means you're not only preventing it from spreading to others by being home for 14 days, the quarantine is from your side. It is your personal duty. It is your domestic duty to the other beloved members of your family, as well as your national duty. So you don't need a stamp to tell you you have to be in quarantine. Really, we can break the chain if we treat it. Imagine instead of COVID, we had chickenpox all over. Even if we were asymptomatic, what would we do? We would stay in our own house, in one room, have a lot of ventilation where air comes through one window, goes out through the other, eat from your own plate, eat from your own glass, read a lot of books, listen to music, watch TV, speak to friends on the phone. These are many things you could do. So how are we going to manage this cytokine storm? So the moment the breathing goes down, that is the commonest signs of the COVID infection are fever, throat pain, severe body ache, cough, breathing difficulty, loss of smell, loss of taste, and a lot of other, even you could have diarrhea, a lot of these other symptoms too. So when do you know you need medical advice? The moment your breathing is going down. So something as simple as an app on your phone, you could actually check your oxygen saturation using the pulse oximeter app on your phone, where even the Samsung phones and the Apple phones, you put your thumb on the sensor here and you know if your oxygen saturation is dropping below 90% or not. So what does this cytokine storm, what are these? These are the language of your immune system. So what is this coronavirus? It's actually, a virus is an entity between the dead and the living. It does not have a life of its own. So forget about fighting against COVID. I want you to be fit against COVID. So this dead virus comes and through the spike protein, it attaches to the host cell. And the moment this attachment, this is not the first time we saw a cytokine storm. In the 1918 flu pandemic, as well as the SARS outbreak in 2003, we dealt with the same thing. Now with the COVID, we're seeing microthrombi or small clots which are being thrown. So what exactly is happening? Lot of us have mutations in like the PRF1 gene. That means there's something called perforin, which is a protein. The moment the virus enters the cell, this perforin goes, it's being secreted by the immune cells, it goes and perforates or pokes the cell with the virus until it's destroyed. And the same thing with the cancer as well. How beautiful is our immune system. But sometimes it's like a snowball which is going down a mountain without control. The viral load is more and the perforin is not able to stop. So it keeps banging its head, and then we have the cytokine storm, which produces all the complications. So here the foods which reduce the cytokines are really important for us at this point. So what is a simple food we all have at home is the garlic. The garlic has the allicin, which is very, very important and helpful in reducing the cytokines. So don't forget, for patients, they must have garlic in part of the food, what is being cooked. And then vitamin C, again, super important for patients. This is both preventive before as well as if you have the COVID, you must supplement vitamin C, because this also reduces the cytokine storm by the enzyme neuraminidase. And then we have green tea, which also reduces the production of the cytokines, again super important, especially the interleukin 1 and 6. And we want to monitor the interleukin 1, we want to monitor the interleukin 6, the CRP, the ferritin levels to know what's going on with the patients. And then we have curcumin, which is from the turmeric. You can see how amazing, something in every Indian kitchen, like the turmeric, this alone is important to stop the cytokine storm. So 1 teaspoon of turmeric with a pinch of black pepper. This is super important because again it reduces interleukin 1, 6 and the TNF alpha, that is a tumor necrosis factor alpha as well. And then the other ingredient is the tea tree oil. Again, this also reduces the TNF alpha, and inhaling steam with some salt, turmeric and the tea tree oil really reduces the viral load, because it is the viral load versus your immunity, and you want to do everything to reduce it. So like again, sleep is super important because it can do everything for you which even a million medicines cannot do. And lying prone on your belly, that is lying on your stomach, helps the lungs to open up completely. Again, very, very important. So now that we have done all the foods which are really important, again, your interferons are being increased by N-acetylcysteine, which is both preventive. You can take it if you're working with patients or if anyone in your family has it, or if you already have the COVID infection as well. And don't do any exercise. What not to do is very important. No exercise of any sort, just lying in bed, allowing your body, the metabolism to stay low. And then what should not be eaten is white sugar, honey, no echinacea, and chocolate as well is absolute no-no when you're actually having the infection. Remember, these things are important. And vitamin D is really important because 90% of us in India, we are deficient in vitamin D. So make sure each of your patients, each of your family should have adequate vitamin D levels. So even if someone is very poor and living in a village, make sure they spend at least 1 hour in the sun in the morning. And again, make sure that they eat green leafy vegetables and whole grains and different colored vegetables, because these are super important. If the fever is mild, it's actually like boiling the milk where your immune system, why do we boil milk? To kill the bacteria. Similarly, your immune system, the fight is going on, the battle is going on between the virus and your cells. So let it be if it's low. If it's a bit high, you can take paracetamol, of course. And then also cold towel can be placed like this on the head of the person. That is also very useful. And don't panic, because really staying calm is what keeps your immune system fantastic. And if someone is living in a village, suppose they're tribals in Maharashtra, they can't afford sanitizer, what are we going to tell them? First, take water in your hand before you apply the soap, because only then the soap is spread all over your hand. and teach them with any soap, whatever they have, to wash their hand. And also after they bathe in the morning, even just taking a few drops of sesame oil, mustard oil, or olive oil. These 3 oils, if you apply it all over your body, this is the greatest protection you can have. Because the fat itself emulsifies and neutralizes the capsule of the virus. So imagine if you don't have hand sanitizer, you could tell them to use all of this, because many people really cannot afford hand sanitizer. Please pass this information on to them. In the Annals of Internal Medicine, we have 54% of asymptomatic COVID people who have ground glass, that is lung effects which are circular, and this can lead to breathing difficulties or even possible cancers, or even up to 67%, which is in the journal Nature Medicine. So even children, we can have, multi-system inflammatory, syndrome in children as well. So really be respectful. Please have common sense rather than be afraid, rather than running from place to place. If you could only remember, we don't have to try to kill the virus. It is dead already. Let us keep our lungs strong. Let's keep our nation strong. Let's keep everything healthy. So keeping our immune machinery balanced is the most important thing, because there is an automatic genetic updating and a homeostasis which happens in our body no matter what virus comes. I promise you this will go as quickly as it came. If we can remember that social distancing and staying at home, whether it is self-quarantine or home quarantine, it is only for your good. It's your personal duty and your national duty, and together we can win it. Take care. God bless. Thank you so much.